Hello, my name is Haghi from Eclectx team at Heidelberg University, where I work on wearable technologies, sleep medicine, and digital health technologies. Together with colleagues from veterinary medicine, computer science, and medical informatics departments, we recently published a paper on how integrating human and pet health through wearables can shape the future of healthcare 5. In this video, I would like to briefly share the idea behind our recent paper entitled One Digital Health Through Wearables Human Pet Integration Toward Healthcare 5. The paper was published in Frontiers in Digital Health. Let me briefly set the context. Healthcare has evolved rapidly over the past years, from traditional and reactive care to continuous and data-driven monitoring enabled by wearables. However, despite all this progress, human healthcare and veterinary healthcare are still isolated or, in other words, largely separated. This separation means we are missing valuable information that could help us detect risk earlier and manage health more proactively. This evolution is best explained visually using a figure that we have put in the paper. This figure summarizes the evolution of healthcare from reactive care to proactive and predictive models. What we argue in this paper is that the next step means healthcare 5 requires integrating data not only from human but also from animals, especially companion animals that share our daily environment. So this idea is rooted in a broader holistic view of health, means one health. Humans and pets live in the same environments. We share air quality, daily routine, stressor, and increasingly similar chronic health challenges. The One Digital Health concept connects this reality with digital technologies by linking human, animal, and environmental health through data. From a technical perspective, this integration is very feasible. Many physiological signals such as heart rate variability, respiration, movement, sleep, and temperature can be measured in both humans and pets using the same sensing modalities and principles. These shared signals allow us to create comparable digital biomarkers across species. Now, this is where everything comes together. In this figure, we show how wearable technologies can support a wide range of applications from physical activity and sleep to chronic disease and mental health using the same biosignals but in humans and pets. A key idea we highlight is the reusability or repurposing human wearable technologies for animals for several benefits. This can reduce costs, accelerate adoption, and significantly improve health monitoring in veterinary medicine. Of course, it's important to be realistic as well. So this approach comes with many challenges. This include anatomical differences, motion artifacts, sensor calibration, data integration, and question around privacy and interoperability. But these are engineering. We can look at them and solve them from the engineering perspective as we see them as a system design bottlenecks and challenges. So in conclusion, what does this all mean in practice? Integrating wearable data from humans and pets enables a more holistic, predictive, and preventive healthcare model. By breaking down species boundaries in health data, we move toward healthcare 5, where risks are detected earlier, intervention are more precise, and quality of life improves for both human and animals. This was a very brief summary of the paper to give an inspiration and give the key points what we discussed during the paper. If you are interested, you may refer to the paper and read the full paper. If you may have any question, please do feel free to contact me. Thank you for listening.
Subscribe the channel to get instant updates of our publications.